Hello and welcome to another lesson of cardiophysiology with Dr. H. And what I'm going to be teaching about today is the electrocardiograms. Electrocardiograms, also known as ECG, often known as EKG. Where the heck does that K come into play? Well, that's Dutch for cardio. And the guy that invented the EKG was Dutch. So cardio spelled with a K there. That's why it's EKG. Now, don't mind all of my, well, I don't know, not great pictures of the heart. We'll get back to these in just a little bit, but I wanted to make sure that they were prepared beforehand. I am by no means an artist. I do not claim to be an artist. So an EKG, what I recommend that students do first and foremost is understand what an EKG is actually a representation of. Okay, an EKG is going to be, in essence, electrodes placed on a patient's body. So they're going to put electrodes on the right wrist, the left ankle, and then a myriad of other places on a patient, depending on how many electrodes that there are. And so I think a lot of students often say, well, what the heck is an electrode? A lot of students don't know what an electrode is, which is fine. So let's define an electrode real quick. An electrode is a little sticky patch that we actually can attach a wire to, and that electrode picks up electrical signals in that location. And it's going to be a measurement of all the electrical signals in that particular location. And hopefully when you guys are thinking of electricity, you're thinking of voltage moving through the body. And as the heart creates an action potential, that action potential travels through the heart, yes, but it also is going to reach out to the rest of the body because electricity moves from point A to point Z. So an EKG, as I'm mentioning, is a measurement of the electrical activity of the heart when it reaches the body surface, and we're going to be able to measure that using the electrodes. Now, here's a catching point a lot of students don't quite get the first time around, is that an EKG is a representation of the sum of all of the heart activity. It's not an action potential. So it's not a measurement of a single cell on that heart. It's a summation of the entire electrical current going through the body. And what we do now is we're going to take two electrodes. Doesn't matter which two. Okay, whether it's the wrist to the wrist to the ankle, or to another one of the electrodes that you're measuring from. And you're comparing the voltage between those two electrodes. And that's what an EKG is. That's going to make a little bit more sense when we draw out an EKG, and I left the space open here in the middle for us to do just that. So, what I recommend all my students do as they are going through an EKG is first and foremost just draw it. Just stop thinking so much and just draw an EKG, just like you try to draw the anatomy of anything else. And yes, an EKG is like learning anatomy. And based on the structure of an EKG, that's going to determine the function of that EKG. So let's get down to it. An EKG tends to look a little bit like this, right? Where there starts out as a flat line. And then there's a little bump. That little bump's going to have a little plateau. And that plateau is going to have a little branch down. Okay, it's going to spike downwards before shooting way up. My heart up here is a little bit in the way, but I will work with it. And then after it shoots way up, it comes straight back down and it actually goes past the point of the previous little nadir over here. Comes back up, flat lines for a little bit, and then has another hill. And this hill is a little bit bigger than the first hill before having a flat line that actually goes for quite some ways. And what's going to happen is that this point is just going to lead right back to this point, and it repeats the process again. This is the anatomy of an EKG, and I highly recommend just drawing it. Draw it a couple times, get comfortable with the first hill, the plateau, the first depression, the big peak up, the big peak down, the second depression, the second plateau, the bigger second hill, and a big long flat line. If you guys can just hit pause, draw it out a couple times in your notes, I would highly recommend it. Once you get done with that, we're going to label this thing. Okay, so now we're just going to go and we're going to find the anatomy. And we're going to say what anatomy looks different from the rest of the graph. So I'd say the first thing that looks different is this point right here, this first hill right here. And I actually don't know the reason why we started with P, but this is just going to go through the alphabet. The first anatomical feature is a P. And it's going to be called a P wave. The second major anatomical position is this depression right here. So this is a Q. The next major is the peak, R. The next major is this next nadir down here, S. And these three things together, the Q, R, S, are referred to as a complex. So all of this together is going to be what's called a QRS complex. And we'll draw that out again in just a second. QRS complex leads to the next major anatomical feature, which is this place over here, and this is going to be the T. And since it's another big wave, it's called a T wave. P, Q, R, S, T. The P wave, the QRS complex, and the T wave. So let's try to differentiate what each one of these points actually is trying to represent. Okay, the P wave is actually from the beginning of this bump here to the end of this bump here. That's the P wave right there. The QRS complex is from the beginning of the Q right here, right when the Q starts dropping. It's from the beginning of the Q, and then it's going to go through the R to the very end of the S. Okay, so it's going to be from there to there. That's the QRS complex. Let me go ahead and write that in here. That's the QRS complex. And the next major bump that we've already identified here is the T wave. And the T wave is going to be from the beginning of this wave to the end of this wave. All right, that's a nice, easy start. There's a little bit more to think about. Okay, there's another place on the curve that we haven't identified yet. See how we've identified from the beginning of the P to the end of the P. But we haven't identified this little plateau right here. Okay, this little plateau right here goes from the end of the P wave to the beginning of the QRS complex. Okay, so this in some textbooks is called the PR segment, and in some textbooks it's called the PQ segment. We're going to go ahead and keep it simple here. Most of the textbooks that I have looked at call it the PR complex. Doesn't mean that I'm always right on all this stuff. So always go with what your professor is teaching. So this region under the curve right here is the PR segment. Just going to keep our coloration the same and draw some arrows in. Okay, that's the PR segment. The next portion that's been drawn in already is the QRS complex, which ranges from the end of the PR segment to the end of the S, right? So what other portion of the curve have we not identified yet? Well, we haven't identified that portion of the curve right there. And that portion of the curve right there is going to go from the end of the S to the beginning of the T. So you might be starting to get it. This is going to be called the ST segment. The PR segment and the ST segment. So one more place that we haven't looked at yet. And that is this big, long, flat portion here. And as I mentioned earlier, we're just going to continue this until it reaches the next P wave. So it's also that portion of the curve there. So this is going from the end of one T, from the T wave, to the beginning of the next P. So this is going to be called the TP. All right, this is the TP. And this is going to be a TP segment. And that's the major anatomy of an EKG. P wave, PR segment, QRS complex, ST segment, the T wave, and the TP segment. There are a few other things that we haven't discussed here. There are actually things called intervals. There's a PR interval, which goes from the beginning of the P wave to the beginning of the QRS complex. That's called the PR interval. There are other intervals like the QT interval. The QT interval is from the beginning of the QRS complex to the very end of the T wave. So I'm not sure if your professors are asking you guys to learn about some of those, but if they are, hopefully I helped you identify a couple of them. But let's go now and try to understand what each part of these actually are indicating. Remember what I mentioned at the very beginning. The EKG is a representation of the summation of all the current going through the body. So when we're looking at the P wave, we're looking at the very beginning of a cardiac cycle. Where is this electricity coming from? Well, let's think about what's starting that cardiac cycle, right? Hopefully you guys have started to do that little bit of logic together. What's the very first part of a cardiac cycle? What's got to happen first? The autorhythmic cell has to create an action potential. Right? The autorhythmic cells are creating action potential. So if that's the first thing that happens in a cardiac cycle, autorhythmic cells are creating electricity. Doesn't it stand to reason that the P wave is going to have to do with this? And that's exactly how this works. Okay, so the very first part of this whole thing is the P wave is going to originate from the SA node. And it's going to travel through the internodal pathways. And it's branching off and it's feeding off to all that atrial myocardial tissue before making it down to the AV node. And we'll draw the AV node in just a second. So hopefully it stands to reason that the P wave is going to be the current rushing through the atrium, and as it does so, the atrium, those myocardial cells, are depolarizing. And that's exactly what the P wave is a representation of. The P wave is a representation of atrial depolarization. Running out of room. Let's just wrap it around here because why not, right? So the P wave is a representation of atrial depolarization. Well, where does the current go from there? Well, the current from there is all going to end up meeting down here in the AV node. And as it goes through the AV node, everything slows down. No currents really moving in any direction. Can you see right here that the PR segment is a flat line? Why? Because the summation of current going through the heart is nothing. This PR segment is a representation of slowing that current down before sending that current into the interventricular segment, into the interventricular septum. So the PR segment is now a representation of what's called AV nodal delay. AV nodal delay. Okay, this is slowing this current down right here. So let's keep showing what's happening. During the AV nodal delay, and we're going to draw it into our second heart over here. During the AV nodal delay, the atria had just previously depolarized. Well, what comes after depolarization, right? When you look at the action potential for myocardial cells, you get this huge spike in depolarization as sodium rushes into the cell, and then you're going to get this big long plateau phase. And during the plateau phase, calcium is entering these cells. What does that tell you? Those myocardial cells will be contracting. And that's what I tried to show here in this image, right? Is that at this point, not only is there an AV nodal delay, but this is also, the PR segment is also a time when the atria contracts. Atrial systole. What happens next? Well, if you look at your EKG, what's happening next? The QRS complex. So let's ask ourselves what's happening next in our conduction pathway. What does happen next in our conduction pathway? That current is going to pass down through the bundle of His. It's going to pass down through the bundle of His from the AV node. And where does it go from there? Oh man, all over the place, right? Now is when it goes down into all these bundle branches that are going to spread out. The bundle branches branch and feed the interventricular septum and the tissue around it with electrical current. They continue to branch until they reach the apex of the heart. Now they spread out through the rest of the ventricular myocardial tissue. So this current goes through the bundle of His, the bundle branches, and the Purkinje fibers. And as it does that, doesn't it stand to reason that a huge chunk of tissue is depolarizing as all of this current rushes down into the apex of that heart? And that's exactly what QRS complex is a representation of. The QRS complex is the period of time when the entire ventricular system is depolarizing. Okay, this is ventricular depolarization. We're running out of room. Now, something else that's important to think about that's happening during the QRS complex is that as the ventricles are depolarizing, this happened just after, right? It just preceded the atria contracting. So what happens after muscles contract? Well, at the very end of the plateau phase, muscles are going to go through repolarization. So while the ventricles are depolarizing, what's happening in the atria? The atria is repolarizing. It's all happening at the same time. Next, the ST segment is next. QRS complex runs into the ST segment. Well, what's going to happen after the ventricles depolarize? Again, this big, huge myocardial action potential peak and a plateau phase. What's happening during the plateau phase? In the ventricles, the next thing that's going to happen is ventricular contraction. And that's exactly what's happening during the ST segment. Okay? Depolarization's already occurred, and now these muscle tissues are contracting, right? They are contracting, and they are going to be moving blood out of the heart during this time. This is when ejection happens, and it's going to happen a little bit into the T wave, by the way, but when we look at an EKG, this is the primary location that we are going to think about how the ST segment is the period of time that the ventricles are contracting. Remember, this is called ventricular systole. We already talked about atrial systole over here. And the only thing I didn't do to make it similar to everything else is underline PR segment. Atrial systole is occurring during the PR segment. Now, ventricular systole is occurring during the ST segment. What happens next? Well, look at the EKG. You can see this big, huge curve. Yes, is going upwards. We'll come back to that in just a second. This is the T wave. And the T wave occurred just after the ventricles contracted. So what's happening to the ventricles following the plateau phase? The same thing that happened following atrial systole over here. Over here we had atrial repolarization. Now the T wave is a representation of the repolarization of the ventricles. So this is now when potassium is rushing out of all these ventricular myocardial cells. And this cell is going to relax as that happens, right? I don't know what I'm going to draw and say. Let's draw some, let's go potassium efflux here in blue. I didn't really think that part through, right? And as potassium rushes out of all those cells, what we're going to end up seeing during the T wave is ventricular repolarization. Last but not least, after the T wave, there's this big, long, flat line called the TP, all right? The TP. And the TP, well, what happens there? What happens after the ventricular myocardial cells have contracted and repolarized? The answer is a big lot of nothing, because this is the time that the heart is relaxing, because no electricity is moving through it at all. So this big, long, flat line, the TP, is a representation of ventricular diastole. At this point, the heart is relaxing, and as it relaxes, it gets to fill back up with blood. This entire time, blood is going to go back into the chambers of the heart, and the heart is going to fill with blood. That's what's so important with diastole, is that this is the period of time that the heart fills with blood. And that's an EKG, y'all. All right. Step 1, P wave, atrial depolarization. That current reaches the AV node and slows down there. That's the PR segment. At the same time, the atria that had just been depolarized contracts. Atrial systole. The QRS complex, this big, huge rush of current, is because there's so much current going through the ventricles at this time. The ventricles are depolarizing. The interventricular septum, the papillary muscles, and all of the ventricular myocardial cells. At the same time, the atria is also repolarizing up here, which is current. There is current moving. After the ventricular depolarization, the ventricles get to contract. Ventricular systole occurs during the ST segment. Following contraction, they start to repolarize, and that repolarization is a massive flood of potassium rushing out of all those myocardial cells. So you actually see a very large wave of current. One side note that I didn't mention before is that potassium efflux is normally associated with repolarization, and when you draw an action potential, repolarization goes from a positive value towards resting membrane potential, which is a negative value. So normally it would drop, but remember, an EKG is not an action potential. It is a representation of the sum of all electricity going through the heart. So it doesn't care whether it's depolarization or repolarization in terms of the direction that it goes. What it cares about is the direction the current is moving towards the electrodes. Whichever direction the current's moving towards the electrode, whether it's a depolarization event or a repolarization event, if it's moving towards the positive electrode, you'll see positive. If it moves towards the negative electrode, you'll see negative. And that is why the T wave goes up and not down. Finally, after those ventricles have repolarized, the heart gets to relax during the TP segment and it's going to fill with blood. All right, that's the EKG summarized. Hopefully that was helpful to you all that are going and frantically trying to study this material. I recommend drawing out the EKG. You don't have to draw out these hearts. They take a lot of time. Again, I'm not a very good artist, so it took me a long time to come up with these hearts. But best of luck studying. See you in the next video. Humankind, be both.